Hello, everybody. I'm Rob Wallace here in St. Paul, Minnesota. I'm an evolutionary epidemiologist with the People's CDC, here with an update on the COVID-19 pandemic. This week, we'll cover the state of global COVID, the state of U.S. COVID, and explore the true numbers and lives lost to the pandemic. We begin with global COVID. In the graph in red, the Johns Hopkins Coronavirus Resource Center reports a small decrease to 7.2 million new confirmed COVID cases worldwide for the week ending August 7th. That's more cases than any other COVID wave except Omicron this past winter. The number of global weekly deaths there in white underwent another increase to 17,600 deaths this past week, although still less than in all the previous wave. In green, we see a decrease to 56 million new vaccinations administered this week worldwide. This New York Times map shows hotspots over the past week in the Americas, Europe, Asia, and Australasia. There in purple, Finland, Latvia, Moldova, Slovenia, Serbia, Turkey, Greece, Japan, South Korea, Taiwan, Australia, and New Zealand continue to be epicenters in average daily new cases per 100,000 population. Russia and Mongolia hosted increases in caseloads. Mexico, Costa Rica, Paraguay, Spain, and the UK reported declines in caseloads, as did two regional groups, Peru, Ecuador, and Colombia, and France, Germany, Italy, Switzerland, and Austria. Here's a 7-day average of daily confirmed COVID cases per million people from the beginning of the outbreak all the way to today on the right. We can see the spikes in cases when Omicron emerged in late 2021. The present hotspots we noted in the previous map are trending in different directions. Finland, South Korea, and Japan are reporting strong increases. Greece is showing spikes up and down, which may be a function of reporting. Serbia, Latvia, Slovenia, and Mongolia are reporting steady increases. France, Germany, Australia are reporting declines in their months-long epidemics. Costa Rica reported a sharp decline off its recent spike, and Taiwan is showing a steady decline off its recent surge. The US and Russia are reporting slow but steady increases. Our World in Data here reports none of the countries highlighted all in gray have been releasing national testing data as of July 3rd. Here we have COVID deaths per million people for these same countries. The individual trajectories in deaths per population here are different than for caseloads. At the right of this time series, Finland is showing a sharp spike in deaths. Greece appears in decline off its recent spike. Australia, Italy, the UK, and Germany are still showing steady deaths, even as their caseloads are in present declines, likely marking last month's infection patterns. Slovenia, Serbia, South Korea, and Japan are showing steady increases in deaths aligned with their steady increases in cases. Another way of tracking COVID deaths is to measure what's called excess mortality, how much the overall population death rate exceeds that of the average death rate in the years before the pandemic. We can see some well-known terrible moments for the set of countries we've been looking at today. We see the spike at the start of the pandemic in the UK and Italy. We see India's horrible surge in deaths with the emergence of the Delta variant. We see the US's steady excess deaths across the pandemic, except upon the arrival of Omicron. In contrast, we see South Korea and Taiwan largely escaping COVID deaths until Omicron appeared. That all said, we also see other countries that have been reporting little in the way of COVID cases and deaths all along, showing huge waves in excess deaths. Many of these countries are in Eastern Europe, including Russia, Serbia, Slovenia, Moldova, and Latvia. Caseloads aren't the only COVID dynamic evolving. The virus itself evolves. We regularly update next strain's family tree for COVID samples over the past 6 months. We do so because it is important to emphasize that the virus is still a moving target. And a pandemic that continues to infect 7 million people worldwide a week is in a position to continue to experiment with the human immune system, and as we have shown in previous episodes, evolve out from underneath our vaccines. We see in dark blues and purples the early variants like alpha and beta. In the light blue are samples of the Delta variant. We see over the past 6 months that multiple Omicron subvariants, they're in yellow, BA1 and 2, in the light and medium oranges, BA4 and 5, and the darker orange, BA2.12, are continuing to explore SARS-2's evolutionary space. We see in the few red samples the arrival of subvariant BA2.75, or the Torres variant, found first in India in June. Across the Omicron group, we find molecular changes from the root of the SARS-2 tree, here numbering as high as 62 amino acid changes and 16 deletions. That's saying the virus continues to evolve. The other key point is that all the Omicron subvariants, except one of the BA2 clades, are presently in circulation. Omicron is conducting parallel experimentation on our immunities in an almost industrial fashion. Evolutionary biologist Trevor Bedford connects this evolution to COVID's possible future. He notes that this summer, many countries across the world, as shown here, are uncharacteristically getting hit badly, in this case by Omicron BA.5. He proposes this might mark a switch out of the run of winter spikes that depend on the usual accumulation of susceptibles in the summer that BA.5 may be presently draining. We might push back here, though, however, that interesting possibility presumes these BA subvariants produce immune protection for what's coming next, and that SARS-2 variants don't evolve to accelerate ahead of that protection. But it is a possibility that we should keep our eye out for this winter. Turning to the US, we see the country continues to host a raised floor in COVID-19 caseloads post-winter Omicron. This summer marks the worst in US COVID incidence of the 3 summers so far in this pandemic. The New York Times map shows the Northeast and Upper Midwest are presently characterized by a relative decline in COVID, but we also see the start of a possible new surge in New Jersey, New York City, and now Pennsylvania. We see sharp spikes in Appalachia, particularly in Kentucky and West Virginia, apparently moving into Western Virginia, Southern Ohio, Indiana, Missouri, and Northern Tennessee. The South is still suffering a surge, although perhaps beginning to abate a bit in North Carolina, Northern Louisiana, in parts of Mississippi and Alabama and Georgia. There remains a surge in Kansas, Oklahoma, and select counties in West and South Texas. We see a slight decline along the West Coast in parts of the Southwest, and sharp spikes county by county across Big Sky states. The Florida Panhandle, Miami, Alaska, and Puerto Rico continue to be hit badly. There are other ways of tracking COVID. The levels of SARS-2 virus detected in the wastewater that comes through our sewage plants, as reported here, July 24th to August 7th, shows little change from earlier in July. Sewage plants in red represent loads at 80 to 100% their previously recorded levels. We see these scattered across the U.S., but especially in Nebraska, Illinois, Ohio, Kentucky, Georgia, and downstate New York. The cool blues of recorded lows in the Northeast continue to be infiltrated by increased SARS-2 concentrations in orange, from New Jersey up north, although many of these plants on that trajectory haven't reported in this round. We do see cooling off in coastal Washington state, Oregon, and Northern California. We also see that cooling off in California there in the light blues by looking at the changes in SARS-2 in the wastewater over the past 15 days. That appears the case too for Utah, Colorado, Northern Illinois, and much of Ohio. On the other hand, many sites in Missouri, Illinois, Wisconsin, Michigan, upstate New York, and North Carolina have reported surges of 1,000% or more there in the reds. To sum up, we see almost the entire country, 94% of the US counties, filled in at the highest level of community transmission, as measured by a combination of cases per 100,000 in the last 7 days and percent positive tests, but only differentiated by CDC up to 10% or more positive. Only parts of California, Nevada, and Vermont appear presently in retraction by this measure. And we see what tests are being reported in, clocking in at 20% or more positive, how much more the CDC does not evolve, 20% or more for almost all the South and much of the Midwest and Southwest. Again, evolution is a big deal. The problem we face continues to change in nature. Presuming any recent declines and damage are part of an intrinsic trajectory to the virus, and that will continue that way, is more wishful thinking than necessity. However much we at the People's CDC do indeed wish COVID-19's disappearance. So as on the global stage, SARS-2 continues to evolve here in the US. We see here new variants first emerging and then dominating in cycles of every 2 months. The BA.2 Omicron variant in pink was replaced by the BA.2.12 subvariant in orange, which is now being replaced by subvariants BA.4 and 5 in green, with BA.5 surging ahead to account for 80% of new cases this past week. We now also see the emergence of Omicron subvariant BA.4.6 in blue. So the pandemic continues to turn here in the States. We end this week's COVID This Week by returning to the excess mortalities we reported on earlier. If you remember, the World Health Organization's model released in May put global COVID deaths through 2021 at 15 million, far beyond the reported deaths there in blue. There's been considerable debate over the methodology of such projections. The Institute for Health Metrics and Evaluation, the Gates Foundation-funded operation at the University of Washington, and The Economist, the magazine, have projected even larger death loads over the world. All, however, indicate COVID's overall death load to be at least 3 times the official count. Dmitry Kobak mapped out these excess deaths by European province, with the worst gaps between pre- and post-COVID mortalities along a couple gradients, including into Spain, clearly eastward through Eastern Europe, and down into the Balkans. In the US, Calvin Ackley's teams show New York City and New York City proximate counties, and through the South and the Plains have been particularly hit by excess mortality associated with COVID. It's why when official US offices from the White House to CDC and NIH soft pedal even those official numbers by juking the way hospitals are to report COVID cases and deaths, as we have described in previous episodes of COVID This Week, it endangers the American people. Similarly, at the level of public health, this week the CDC announced it is dropping recommendations for quarantining at home upon COVID infection and for testing people without symptoms. People who do still test positive should stay home for 5 days, the CDC continued, although people without symptoms now wouldn't know to. The contact tracing people a patient may have been in contact with, that the administration promised but never really followed up with at any scale of impact, is now over, save in hospitals and nursing homes. The US government across parties not only has placed more Americans at the risk of COVID death, but with the dangers of long COVID, including the illnesses listed here, that few medical practices are prepared to diagnose, much less treat. Even steps forward act to cover for such continuing damage. The administration recently announced it would be establishing a new Department of Health and Human Services office dedicated to addressing the debilitating long COVID that as many as 23 million Americans have suffered beyond their initial acute infections. An associated national research action plan on long COVID is to be pursued, but in parallel with administration efforts to return to normal and strip out programs in COVID prevention. In other words, the supply of extremely difficult to treat long COVID cases the administration now says it seeks to mitigate will continue apace to accommodate employers that as a class want everybody back at work, whatever the COVID risk. Such denialism has extended into the American Public Health Association, the largest professional organization for US public health practitioners. Not only did the association at first opt out of mandating masks at its upcoming conference in Boston, but it now has invited Leanna Wen, a leading COVID denialist, to speak at the conference. Wen, who once spoke out against mass incarceration and white supremacy and once led Planned Parenthood, is a Biden apologist on COVID. But long before Biden's election, through her Washington Post column and position as a CNN medical analyst, Wen found every occasion to pronounce the pandemic no big deal, all the way through 1 million American deaths, denouncing even what were typically weak mask mandates and the shortest of school closures. When the major public health association throws in with the individual responsibility to a pandemic that Wen champions to employers' relief, we might ask whether public health as both a concept and daily practice still exists in the US. And that's COVID This Week from the People CDC. You can learn more about the People CDC and read this week's COVID weather report at peoplecdc.org.